That's great.
Perfect. So Jenny, over to you, and please take it forward. And if anybody, participants, have any questions, please feel free to put it in the chat. I will make sure that I'm following through the chat. If not, at the end of the session, if Jenny is comfortable, is okay, you can raise your hands and then we'll give each one a chance to ask questions. Does it sound okay, Jenny?
That sounds perfect. Thank you so much, Ruchi.
Perfect. Over to you. Thanks.
All right. Well, good afternoon, everyone. Thank you again for joining us today. We are thrilled to be here with you. And as Ruchi said, I'm Jenny Arredondo. I'm from the Washington Health Benefit Exchange, and I am lucky enough to be joined with two of our good partners, from Emily from the Healthcare Authority and Callista from Public Health King County and Seattle. So thank you both for being here and joining me in this presentation. So we do want to make this interactive as much as possible, and we want to make sure that you have the opportunity to ask any questions. There are no silly questions. We work in health insurance and we understand that it can feel overwhelming and complex, and we are here to break it down for you all so that you can help connect your audiences to health insurance. Because as Ruchi said, health insurance really is a matter of health access and health equity, and can really be life-saving or life-changing for folks. So we want to make sure that as many folks as possible can access health insurance so that they can see the doctor and have health coverage and access to medical services as needed. Okay, so again, this is a collaboration. I am by no means the expert here in the crowd, so we will do our best to answer any questions that you have. I think, first of all, I'd love to know who is here with us today. So if you wouldn't mind popping your name into the chat as well as the organization that you represent this afternoon, that would be great, just so we get to know all of you as well. All right, Ruchi, if you could move it to the next slide, that'd be great. All right, so I am the sponsorship and outreach manager for the Washington Health Benefit Exchange. We operate the state's online marketplace called Health Plan Finder, where folks can shop for and compare and purchase plans, health insurance plans. And I'll pass it over to my colleague Emily to introduce who she is.
Hi, my name is Emily Good, and I work with the Healthcare Authority. I am a Medicaid Eligibility Policy Manager with the Office of Medicaid Eligibility Policy within Healthcare Authority. And we look at policies centered around eligibility for MAGI, and we'll get into what MAGI is, but MAGI programs and Medicaid coverage. And I will pass it to Callista.
Good afternoon, everyone. I'm Callista Kennedy. I am the Navigator Program Manager with King County Public Health's Access and Outreach team. I'm also a certified navigator and enhanced user. And so we help enroll people and educate people on health insurance and the Health Plan Finder. And I'm glad to be with you all this afternoon. So thank you.
All right, Ruchi, if you could advance to the next slide, please. And I'm just taking a look at all the list of amazing folks that we have in here with us today. So thank you again for being here, and what a great list of folks and organizations that we have represented. So to tell you a little bit more about the organization that I represent, the Washington Health Benefit Exchange, it was created by the Washington Legislature in 2011, and it operates the state's online health insurance marketplace, like I was talking about, Washington Health Plan Finder. And so at WA Health Plan Finder, you can sign up for free and reduced Apple Health, and we'll go into that. I'll let Emily go into that, as well as shop for other plans, which we call qualified health and dental plans. Over 2 million, that's around 1 in 4 Washingtonians, currently use Washington Health Plan Finder to access high quality insurance, and it's used used by folks that are just not offered employer coverage. So those that are self-employed, employees of small businesses who can't offer health insurance to their employees, seasonal workers, those that have lost employer coverage, those that participate in the gig economy or work seasonally or do not yet qualify for Medicare. So a lot of folks are going onto Washington Health Plan Finder and accessing health insurance. So we're really trying to get the word out there and make sure that everyone knows their options on Washington Health Plan Finder. Next slide, please, Ruchi. So on Washington Health Plan Finder, you can purchase individual qualified health and dental plans that fit your needs and lifestyles. We have lots and lots of plans at lots of different costs and lots of different coverage options and needs. It's the place where you access federal tax credits as well as a new state tax credit that lower your monthly cost for health insurance. And it is also the place to apply for and get Washington Apple Health, which is what Medicaid in the state of Washington is called. So Apple Health, and that's free or low cost coverage. Ruchi, next slide, please. So I'll pass it over to Emily to talk a little bit about Washington State or the Healthcare Authority. Go ahead, Emily.
Okay, so HCA is the largest purchaser of healthcare in the state. We lead the effort on transforming healthcare through programs and initiatives that range from the administration of Apple Health Medicaid and behavioral health activities to developing models for value-based purchasing and health technology assessments. We do use data to inform our decisions and work in collaboration with local communities to ensure that Washington residents have access to better healthcare at a lower cost. So we do have workers across the state of Washington that help clients with accessing the Washington Health Plan Finder to get access to Medicaid coverage. So free or low cost healthcare coverage is what we offer. And if someone is in need of getting healthcare coverage, as a Washington state resident, they or their family may be eligible for free or low cost medical, dental, vision, and behavioral health services through our Apple Health Medicaid programs. HCA or Healthcare Authority works closely with the Washington Health Benefit Exchange as both entities share the single streamlined application for healthcare coverage through Washington Health Plan Finder. Go ahead and change. And Calista.
So we are King County Public Health Access and Outreach, and what we are is called the lead organization. When the Healthcare Authority and the exchange put the marketplace online to enroll individuals into health coverage in Washington state, they broke down the state into sections, and there is what they call a lead organization, which for us is public health. In other parts of the state, it's different nonprofits or clinics like CMAR that take the lead in their counties to help the folks that live in their counties enroll and access healthcare. So for King County, that's us here at King County Access and Outreach. And how we did this is we build systems. We contract with and work together with public clinics, hospitals, nonprofit organizations, and other public service agencies to build a system in which individuals, where they're accessing services, where they're going to get other types of assistance, can also access navigators and get assistance enrolling in healthcare. And we assure that that access is well developed throughout our county, spread out across the entire county, so that we assure that people have places to go and ways to access healthcare. And we also run a phone line in order to provide that additional access. We develop enrollment programs. We set up outreach to help enroll the most vulnerable in our county with the least amount of access, a reduction in barriers to getting access to help for healthcare, as well as some other services that I'll talk about later. We operate under the county's policy that racism is a public health crisis. And so we've developed teams in our Black and Hispanic communities. These equity teams create partnerships, create programs to help people access and have a place to come to get help with services. And so we've also done this with not only the Navigator Network that I just talked about, but also our King County Orca Lift Network that works on our reduced fare transportation programs. So that's where we fit in all of this. The exchange, the healthcare authorities, they manage, they do policy, they support and create the programs, and then we're out here as a lead organization providing the community with access and partners, which we develop to provide additional access. Next slide, please. So what is health insurance? Next slide. On the surface, health insurance is the agreement that you make with an insurance company to help pay your bills, right? You pay a monthly premium, whether that be you signed up through the exchange and pay to the insurance company you chose, or whether that be through your employer and it's coming out of your paycheck, right? You pay them, and then they help you pay your medical cost if you have to go to the doctor or have to get a prescription or go to the hospital. That's on the basis of what health insurance is. And it's a way for you to have the guarantee that if something were to happen, or that if you need medical treatment, that the cost is not so overwhelming that you don't seek care or you're not able to get care. So that's basically what health insurance is. Next slide. But more importantly is, why is this important? So next slide. The reason that it's so important is what you see here. It ensures that you get your medical care and prescriptions when you need it. It allows you to avoid potential medical costs, and it gives you peace of mind for whatever life throws at you. Before the Affordable Care Act came along, we had things like insurance costs that were so high that people were filing bankruptcy due to the debt that they were incurring with medical care. We had people that had just an overall inability to get medical care. And so being able to bring insurance to people in a more affordable way, such as through a health exchange like we have here in Washington State, has helped avoid some of these pitfalls and barriers that were created for access to care. But most importantly with insurance is it's something that you just can't go and get when you need it, right? So you go in, you have, say you break your leg and you go to the emergency room and you have this enormous bill. You can't go and sign up for health insurance unless you qualify for Apple Health. That's going to cover that visit because insurance goes forward. So having insurance in place from the beginning allows you to have that knowledge that you have something in place that when something happens, you will be covered and be able to access care. Next slide. So this is just a sample, and let me just say that some of these actually are a little lower than they probably are. Actually, the slide is most likely a little bit outdated. So, but you can see some of the costs that folks would incur or can incur when they have some pretty basic services, what you see here. Screening services like mammograms and colonoscopies, urgent care, say you just can't get into your doctor, costing you nearly $200. So these are just some examples, but just to note, this is why insurance is in place, so that the bulk of the costs for these services doesn't fall to the individual and prevent them from either seeking care or getting care just due to the fact that they can't afford it. Next slide. And let's go back to Emily.
Okay.
Or the...
Yep, it's me. So how much does health insurance cost? We want to take a look at the next slide, please. So how much does coverage cost? With Washington Apple Health, Medicaid, it is free or low cost. So it's either $20 per child for children's medical or children's CHIP program, or $30 per child up to $40 or $60. And over 1.5 million people are enrolled in Washington Apple Health at this time. Also, we have qualified health plans and qualified dental plans. And prices do vary based primarily on age and household income. So over 200,000 people are enrolled in these private plans. 100,000 people pay less than $100 per month, and 3,400 people pay, or 34,000, excuse me, pay less than $1 per month. So with Washington Apple Health Medicaid, again, in Washington State, Medicaid is called Apple Health. Apple Health provides physical and behavioral health services for Washington residents who qualify. For the purposes of eligibility, Apple Health is divided into two categories. So we have non-MAGI or classic Medicaid. We also have MAGI-based programs. Apple Health non-MAGI classic Medicaid includes programs for individuals who are 65 years or older, or have blindness or a disability, or need long-term services and support, or LTSS for short. Eligibility criteria varies for each program and is based on household size, income, and resources. These non-MAGI classic Medicaid programs are administered by the Department of Social and Health Services, otherwise known as DSHS. So Apple Health MAGI Medicaid includes programs for adults aged 19 to 64, include children, families, and pregnant individuals. So MAGI, as you've heard me talk about, means modified adjusted gross income. And basically it is the methodology used for calculating income and household size. So when we look at these programs, we look at a modified adjusted gross income. So we look at your gross income, and we look at how many people are living in the household and how many people are requesting we look at for coverage. So all these MAGI-based medical programs are administered by the Healthcare Authority, or HCA, through the Washington Health Plan Finder portal. And I believe that Jenny put the definition of modified adjusted gross income, or MAGI, what MAGI means, in the chat. You can correct me if I'm wrong, Jenny.
Yes, that's exactly what I did. Thank you, Emily.
Okay. And next page. So we're going to take a look at some Apple Health MAGI-based eligibility requirements. So again, Healthcare Authority really looks at those programs.
The link below the Zoom.
I'm sorry. Did you have a question?
I think they might have accidentally been unmuted. Go ahead, Emily.
Okay. So for the programs that we look at here at HCA, there's Apple Health for Adults. This program is for Washington State residents who are aged 19 to 65 years old. They are US citizens or meet the Medicaid immigration requirements and are not incarcerated and have income at or below the program income requirements. This also includes our parent caretaker coverage as well, programs. With that, we also have Apple Health for pregnant individuals. This program provides coverage to pregnant individuals with countable income at or below 198% of the federal poverty level, without regard to citizenship or immigration. Along with Apple Health for pregnant individuals, a newly formed program, which is after pregnancy coverage, is in play. So if you do have Apple Health for pregnant individuals, once that baby is born, the following month, you will be enrolled in our Apple Health pregnant or after, sorry, Apple Health after pregnancy coverage. And that goes for a year after the birth of the baby. So Apple Health for Kids is our next kind of grouping of programs. And this is coverage that is free to children up to age 19 in households with income at or below 215% of the federal poverty level and available for a low monthly premium to children in households with income at or below 317% of the federal poverty level. And the low income premium children is Apple Health for Kids with Premium, or also known as CHIP. Go ahead and change.
Emily,
Yes.
can I add in one thing?
Yes, you may.
Just to note, the after pregnancy coverage is not specified by a birth of a child. After pregnancy coverage is only contingent that you have been pregnant in the last 12 months, regardless of the outcome of the pregnancy. So you would be covered under that program for 12 months at the end of the pregnancy, regardless of if it was birth, termination, or miscarriage. So if anything occurs where the pregnancy doesn't result in a birth, you are still eligible for after pregnancy coverage for 12 months.
Right. Thank you for that. And also a little note on top of that is you don't actually have to have Apple Health at the time of birth to be eligible for this program. Yeah. It's a great program. I was responsible for setting it up. So I thank you for adding that additional information. So yes, at any time after pregnancy for 12 months, you can apply for this after pregnancy coverage and get that coverage for the remainder of that year. Yep. Okay, go ahead and flip the page. Okay, so these are some of our programs that we offer, and it is a chart that shows our income table. So let's say for Apple Health for adults, for a single person, you can earn up to gross income of $1,563 monthly to be eligible for that program. And it goes 2%, 3% on up. It also has the yearly amounts there. These income amounts that you see here are effective from April 1st, 2022 to March 31st, 2023. And to learn more about Apple Health in general and how to apply, how to manage your coverage, you can visit the free or low cost healthcare by looking up Washington State Healthcare and going to their website. And this, I believe you have access to a copy of that. That is a link there in the PowerPoint. Okay, next slide.
Right. I think it's back to me. Thank you so much, Emily. You know, the vast majority of folks that are looking for health insurance are qualifying and getting Apple Health. And so I appreciate you sharing a little bit about that, Emily, and letting folks know that it's not just for kids, that there are programs for adults as well. So the state wants to make sure that all folks have access to health insurance regardless of, you know, their particular situation. So there are options for everyone out there. I'm going to talk a little bit about qualified health and dental plans. And I realize that we are throwing a lot of words and essentially probably new vocabulary at you today. So if you do have any questions or want more explanation on the different terms, please don't hesitate to put that in the chat, and we will try to address them at the end of the presentation. So qualified health and dental plans are plans that you purchase on the exchange. So if you are not eligible for Apple Health, you can purchase a plan. And the cost of that plan is really going to depend on things like your income, your family size, the county that you live in. So there are different options, the level that you choose to have coverage. So we have different metal levels that are called. We have, bronze, silver, and gold plans, and you can choose what's right for you depending on your individual needs, like your health needs or what provider you want to see. So there's lots of different options out there for you. We do, the plans that we do offer on Health Plan Finder are all certified by the exchange, which means they have established limits on cost sharing. And cost sharing is just the amount of money that you pay out of pocket for your care. So things like a deductible. Deductible is the amount that you would pay before your insurance carrier starts paying its portion of the costs. And so different plans have different deductibles based on those plans. Another thing that we've thrown out there is premium. So premium is the monthly cost for being covered for having a plan. And that can vary from $0 to, it can be hundreds of dollars depending on your financial situation, but a lot of plans are quite affordable. We have, I think, 37% of the people using Health Plan Finder are currently paying $0 for their plans, even though they're not qualifying for Apple Health. They are eligible for plans that are very low cost or even $0. All plans cover the essential 10 health benefits, and I'm going to get into those benefits on the next slide. And then all other plans, there's a lot of policy that is involved to make sure that carriers are being held to a certain standard and that customers have certain rights as well. So all plans meet other requirements under the Affordable Care Act, and I won't bore you with the details on that, but just know that there are a lot of people advocating for the rights of customers and making sure that costs aren't through the roof, and that plans are affordable to all different audiences. Next slide, please, Ruchi. So the 10 essential health benefits that all plans, including Apple Health, have to cover. That is trips to the ER, doctor's visits and hospital stays, pregnancy, lab tests, prescription drugs, pediatric care. So these are all the things that all plans have to cover as part of the plan. Next slide. And I see some great questions coming in. I can't wait to dive into them a little bit later, but keep those coming. These are great questions that I think that more than you likely have. So don't be afraid to put something out there. I also want to talk about federal tax credits. So federal tax credits essentially reduce, or tax credits in general, reduce the amount of money that you have to pay for a plan or that a customer pays for a plan. So they are, and federal ones are paid by the government, and then we have a new state subsidy or new state tax credit that is paid for by the state, and they're applied directly to your health plan's monthly premium. So they really bring down the cost of insurance, often significantly. And currently 78% of the people that are using Health Plan Finder benefit from some sort of tax credit to bring down their cost. The amount of tax credits that you get really depends on your income and the size of your household. So the lower your income, obviously, the more tax credits you would be eligible for. Higher income, the less tax credits that you are eligible for. And they are only available through Washington Health Plan Finder for plans in the state, for health insurance in the state. So really encouraging folks to go to Washington Health Plan Finder to have those tax credits really bring down the cost of insurance for folks. Next slide, please. All right, I really want to talk a little bit about Cascade Care Plans and Cascade Care Savings. So on the exchange, there are, I think, currently 78 different plans, and we realize that that's a lot. And comparing across plans can feel difficult and overwhelming for folks. So in 2021, the Washington legislature directed the exchange, which runs Health Plan Finder, to really look at standardizing some of the plans so that folks can compare plans like apples to apples. So all the plans are the same, have the same coverage, but can be offered by different carriers at different costs. And so these plans that can be compared across different carriers are called Cascade Care Plans. And you see this little mountain logo there. So when you're applying for health insurance and you see this mountain logo next to a plan, that means it's one of those standardized plans that can be compared across carriers so that you don't need to read the fine print and figure out, does this cover this? Does this cover this? You know that those plans cover all the same things, and you'll have to compare between the different metal levels. So a bronze against a bronze between the different carriers would look the same, even though they have different costs associated with them. Okay. So they have the same deductibles, they have the same copay, they have the same coinsurance, and they often offer a higher value for the cost. So these plans have typically $1,000 less premium than other plans. So they're really meant to offer higher value at lower cost and make sure that services can be covered before a deductible is charged. And so it's really those states' way of advocating for folks and ensuring that it's easy and understandable on their end, and that plans can be compared pretty easily across the board. Next slide, please. So they offer lower deductibles than most plans. They offer more services before that deductible is met or applied, and they're available in every county in Washington state. Next slide, please. So new this year, so we have the Cascade Care Plans, which are those standardized plans, and new that this year is the new state subsidy called Cascade Care Savings. So this subsidy is meant to further bring down the cost and make sure that insurance is affordable. So we have federal subsidies and we have state subsidies that further bring down the cost. And so in order to be eligible for this new state subsidy that started January 1st, 2023, you need to be under the 250 federal poverty level or federal poverty line. And that is certain income requirements that are set by the federal government in order for government services to be provided. So we can provide you a link of and you likely have it, thinking now, what the different federal poverty levels are and what 250 of that federal poverty level would look like. So it depends on how much how big your family is and how much income you bring in on how that would look for your individual circumstance. But at 250% of the federal poverty level or under, you will get this new state subsidy. And it can provide an additional savings of up to $155 per month per member of the house. So it can be significant for some folks. And it's available on Washington Health Plan Finder, just like federal tax subsidies are. Next slide, please. So this is kind of what it would look like, the breakdown. So let's say a premium was $500 a month, right? And you chose a Cascade Care Silver plan, which is kind of middle of the road, but pretty comprehensive, honestly. And then you had a federal tax credit that was $400, bringing your cost down to $100, right? Before that state subsidy. Once the state subsidy is applied, depending on your individual circumstances, that could bring the cost of your plan down to $0. So really those tax credits can be pretty significant. And then the tax credits can never exceed the amount that you owe so that you get an additional refund. That just doesn't happen. Go ahead, next slide. So in terms of, we talked a little bit about the federal poverty line, and I just wanted to let you know what the Cascade Care Savings limits would be. So for one person, it would be, you could not make more than $2,683 a month. But for a family of four, the income cap for a Cascade Care savings, the state subsidy, is $5,521. So, you know, it's definitely worth looking into, especially I think for the audiences that you all serve, that this income can be fairly high, and folks can still benefit from that with higher incomes. So to be eligible for this, you need to make 250% of the federal poverty level or under. You need to choose one of those Cascade Care, one of those standardized plans, either silver or gold, because the state really wants to make sure that folks have the coverage that they need. And you need to accept all available tax credits, federal tax credits, before the state tax credit kicks in. Next slide, please. So where do I sign up? Next slide, please, Richie. So you sign up on wahealthplanfinder.org. And this is what the website looks like when you pull it up, and we can put it in the chat as well. You would apply for coverage, and it's on the left-hand side in this kind of menu bar. And when you apply for coverage, you are not bound to buy that coverage or to follow through. But applying for coverage will really help you see what tax credits you're eligible for, both on the federal level and the state level. So we encourage folks to fill out an application just so the system can really recognize your individual circumstances and give you an idea of what plans are available to you in your county. Next slide. And then I'm going to speed up a little bit because I want to make sure we have time for questions. But this is once you're applying for coverage, a Smart Plan Finder decision tool, or this pop-up will pop up, and it can recommend plans that may suit your needs. Either they cover a provider that you're hoping to see or cover prescription needs that you have, just making sure that you get the plan that meets your needs. Next slide, please. And there's enrollment assistance. We understand that health insurance feels complicated and overwhelming. We have over 750 what are called navigators, and they're just there to assist folks with understanding health insurance, understanding their options, explaining the different terms to them, and really helping them fill out an application if that's what they need or want. So they can really simplify the process for them. We have 90 tribal assisters throughout the state that work with our tribes. We have over 2,000 certified producers, which are really brokers that can help people apply for coverage as well. The vast majority of these brokers get paid by insurance carriers, not to steer folks one way or the other, but to ensure that this help is provided to folks for free, really. So those are a great option as well. And we have 10 brick and mortar enrollment centers throughout the state as well. And I can get Ruchi a list of where those enrollment centers are, and you can either call them, set up a virtual meeting, or you can just drop by as well. Next slide, please. And I did want to mention before I pass it over to Callista that there is help in over 200 languages. I think we have help in 240 languages. So you can get help through our call center with a variety or all the different languages, or our navigators also speak a variety of languages, and we have our materials translated in lots of languages as well. So if folks do need help accessing health insurance, we can connect with someone or connect them with somebody that speaks their language, or our call center has a translation line that we work with that can really translate on the spot help through our call center, and they work directly with the customer and the call center to really get them the, I guess, the support that they need. I'll pass it over to Callista.
Sorry, my mute. And speaking of that, we at Access and Outreach, we have navigators on our team that speak 7 different languages, including Spanish, Somali, Amharic, just to name a few. So we have staff that speaks 7 different languages to serve our clients here in King County that are actual team members, in addition to using a language line. We also have one of those 10 enrollment centers. Ours is located in Federal Way. It's in the plaza where Trader Joe's is on Pack Highway and 320th, which is open Monday through Thursday until 5:30, and then every other Saturday from 10 to 2. But we enroll residents in person, and then we enroll them at our chat line over the phone. You see both the local and 800 number here. These are just a few of the services that we provide in addition to health insurance. We do the OrcaLift reduced transportation programs, basic food, energy assistance, helping in finding a medical dental provider, a medical dental home, the breast cervical colon health program, in which we actually serve 4 counties, and then our new King County adult dental program. So next slide. And then just to highlight a couple of these programs for you that we do. The OrcaLift, it's now a reduction in fare to $1. So that would be $1 on Metro, Sound Transit, the Link Light Rail, Kitsap buses, all $1 a ride. Sounder Train, Water Taxi are at U3 instead of full adult fare. Oh, actually, no, the Sounder Train is now $1. I apologize, this needs fixed. But the Sounder Train is now $1 as well. So it's a great discount. Then we operate the OrcaLift subsidized program, which is a 1-year free ride pass for individuals who are on SSI or TANF, so cash assistance-based programs. And so they actually ride for free. This also includes their household members. So we can get them signed up for a free ride pass if they are on one of these programs, and that is good on Metro and Sound Transit lines. Breast cervical colon health, like I said, we serve 4 counties, King, Kitsap, Clallam, and Jefferson, that provides breast, cervical, and colon screenings for Washington state residents who either don't have insurance, or if they have insurance and they still have a high deductible, particularly for diagnostic services. Access to baby and child dentistry provides low-income families with a dentist who specializes basically in care for young children, focusing on prevention, avoiding tooth decay. The first tooth, first birthday, first dental visit is their model to get kids into early and preventative dental care. And then for adults in April of 2022, we opened up what's called the KCADP, King County Adult Dental Program. So this is for King County residents only, and individuals that are not eligible for Apple Health due to citizenship status. So folks that haven't met the 5-year bar, people that are undocumented, and we do mobile events as well as schedule them for dental services at public health or community-based clinics. It provides cleaning services, emergency dental care, and some other higher level diagnostic services. A few that are to be included, such as endodontics, are on the way, but for right now, it's that basic overall general dental care that we're providing to residents through this program. Next slide. And when can you sign up for health insurance? Next slide, please. So with Apple Health, it's year-round. You can sign up at any time you're eligible, and Apple Health, when you're found eligible, always goes back to the first day of the month that you apply. So if you apply on December 30th, you're still going to be eligible as of December 1st. And you can also request a 3-month retro look back. For qualified health plans, it does have enrollment periods. So these are times of the year when you can enroll. It's called open enrollment, and it runs from November 1st through January 15th of the following year every year. So this year went from November 2022 to January 15th of 2023. Outside of that open period to sign up for health insurance is called a qualifying life event. So these are things that happen over the course of the year that cause a change in your personal circumstances. So getting married or getting divorced, loss of coverage from a change in your job or a loss of your job, moving to Washington from either another state or another part of the state where it forces your coverage to change, change in household size or members. So things like that that can affect how you're covered, give you a chance to look at new coverage and enroll. Typically, you have a 60-day period before or after the event to enroll in new coverage. And like Jenny mentioned earlier, we get about 78 plans offered per person or household that applies. There are 8 carriers or 9 carriers, I'm sorry, 9 carriers in King County. On this slide here, Pacific Source actually doesn't offer plans in King County. They do offer plans in other parts of the state though. But these are the ones that you'd be choosing from if you were purchasing healthcare as a qualified health plan. So next slide. And so just as a reminder, we have Apple Health available year-round, qualified health plans during open enrollment, and qualified health plans during life-changing events. And next slide.
All right, thanks, Callista. And I saw this great question come in about undocumented folks in our state. So currently, about a fourth of our, I guess, the state's uninsured population is restricted from getting access to health coverage on the exchange due to federal restrictions really based on immigration statuses. So in 2021, the state or the Washington State Legislature directed the exchange to explore avenues for these folks to make sure that everyone had access to health coverage. And as a result, the exchange filed a federal petition or waiver to be able to provide health insurance to everyone in the state, regardless of federal immigration status. And I'm thrilled to announce that this past fall, that waiver was approved. So we will become the first state starting January 1st, 2024, to be able to provide health insurance to any individual, regardless of immigration status. So we are super excited about this, and we're working really hard to ensure that everyone knows their options and has access in the language that they need. Next slide, Callista. Or not Callista, sorry, next slide, Ruchi. So this waiver will allow more than 105,000 folks that are currently prohibited from obtaining health insurance through the exchange to access health and dental insurance on Washington Health Plan Finder. So this is a first in the kind waiver, and we're thrilled to announce that January 1st, 2024, all Washingtonians will be able to access and purchase plans through Washington Health Plan Finder. Right now, in the legislative session, they're considering whether to make essentially a look-alike program, an Apple look-alike program for this population. The funding is currently not there, but we are keeping our fingers and toes and nose hairs crossed to ensure that it is accessible, and part of that accessibility is affordability. So while everyone will be able to access health plans on the exchange, we want to make sure that everyone can access Apple Health as well. So write your, I mean, officially, I guess I shouldn't be saying this, but make sure that it is well known if that's something that is important to you, because we want to make sure that it, like I said, it continues to be accessible. So shopping for plans will begin November 1st next year for coverage starting January 1st. Next slide, please. All right, we made it to the end of the slide with a few minutes to spare. I hope this was informational and that you got what you needed, but we would also love to hear from you all. Do you have any questions? Is there anything else that we could address to make sure that you have the information to connect the people that you serve with health insurance? And feel free to either pop off mute or put them in the chat so that we can read them out loud and ensure that everybody hears the different questions. And does anyone have any questions to start with?
I do. I'm just wondering, for the medical insurance for everyone to be covered, is that going to go by income still, or because we have some families that are undocumented in our program, and they claim their income, but they don't do taxes.
Yes. So for the new immigrant health coverage that will be provided starting January 1st, those folks will not be eligible because it's for federal tax subsidies. That is something that we have here in the state of Washington no control over who is eligible. They set eligibility determination requirements on a federal level. That being said, the folks that come into this program January 1st will be eligible for the state subsidy, and that is based on income. So if those folks qualify for Cascade Care Savings, that state subsidy, then they will receive that.
So how would they qualify if they're not making any money or very little?
Up to 200% of the federal poverty
Okay.
level.
Okay.
Yeah.
Thanks.
Yeah, great question.
It's essentially, if you've ever had someone who currently enrolls through the Health Plan Finder that say doesn't meet the 5-year bar, right? So they can't get federal Medicaid. Normally, if someone had income below 138% of the poverty level, it would put them on Medicaid. It would not offer them the qualified health plan and the subsidy. So this is essentially functioning the same way. They don't meet the federal requirement to get Medicaid, so it's going to show them eligibility for a qualified health plan. The only difference is if they are not filing federal taxes and don't meet those federal requirements, no social security number and things like that, it's not going to give them the federal tax credit assistance. It's only going to show them the Cascade Care amounts that are eligible to them.
Thank you, Callista. Emily, I see there's a question in the chat. I know there are different kinds of Medicaid that a child might have, for example, Molina, et cetera. What is the easiest way to find a list of in-network providers or specialists?
So I am currently looking for the link. We do have a online provider search for providers and who is with who. So if you want to see your current doctor, if they are enrolled in, let's say, Molina and will take Molina, you can look that up as well. So I am looking for that link and I will put it in the chat as soon as I find it.
And
Perfect.
just to clarify, it's not different kinds of coverage. When they're on Apple Health, everybody has the same kind and type of coverage. It's Medicaid. What the difference is it's a different managed care company. So it's managed care, which is essentially a carrier like a health insurance that pays for the services. And with these 5 different plans on Apple Health, Molina, Community Health Plan of Washington, United Healthcare, Amerigroup, Coordinated Care, they get to choose that company's network of providers. So in addition to that link, which is great and quick, you can also contact the plans directly to see who their providers are, or go to their websites, and they have their own individual searches for just their providers and their primary care. The good thing about how Apple Health is managed, though, is if there needs to be a change, if they need to change their managed care, they can change that once a month until they get the right managed care companies. And the managed care companies also allow individuals that are covered the flexibility of changing their primary care providers when needed. So they do have that flexibility and give the clients their choice in their care by allowing them to choose and change plans when they need to.
Thank you for clarifying that, Callista. I know that we are at time, but I'm willing to hang out for a few more minutes just to make sure that folks get their questions answered. And as well as Ruchi, I know you sent over a couple of questions and Callista answered them online, but I also wanted to make sure that everyone heard those answers as well. So maybe we could address those as well.
Sure.
Yeah.
So do you want me to read those, or Callista, do you want to address those?
Yeah, I think the one was the one we just
Yes.
answered. And then the other one, I think I saw this pop back up in the chat too. It says, for adults who don't qualify for Medicaid and can't afford health insurance, what low cost or sliding fee options are there for medical and dental treatment? And so one of the things that I did, and Ruchi, you're more than welcome to share is I provided, we put together a brochure called Looking for Good Healthcare, which lists in King County the sliding fee scale community-based clinics. So the CMARs, the Health Points, the Neighbor Cares, where people can go and access medical care on a sliding fee basis. The other thing is that hospitals that have outpatient medical clinics like Swedish and Harborview also extend their charity care programs to those qualifying individuals to receive care. So if someone has gone through the charity care process at one of the hospitals, that generally will extend to them scheduling outpatient care at one of the hospital's affiliated clinics. And then the King County Adult Dental Program that I mentioned that we started. Also coming up from April 27th through the 30th, the King County Dental Clinic, or sorry, the King County Clinic is returning to the Seattle Center. This is that clinic that happened annually that's been gone a couple years because of the pandemic and the construction when Key Arena turned into Climate Pledge. They will be back this year in April serving that mass clinic. Individuals are required to get tickets to receive service. Generally, this clinic serves about 3,000 to 4,000 people over 4 days. I provided Ruchi with some of the flyers to that event, and the flyers are available on the Seattle Center website in 12 languages if you wanted to log on and share those with your prospective clients if they want to come to the King County Clinic. And it's a full service one, so it's got the medical clinic, it's got the wound care, the mammograms, the dental clinic, all back for the public in April.
Wonderful, Callista. Appreciate you sharing that. Does anybody have any other additional questions that we haven't addressed that you would like to ask? All right, I'm not hearing anything. Stephanie, I saw you come off mute. Did you have something?
Did you already say how we'll be able to access the recording?
Yes. So Stephanie, that's a question for me. This is Ruchi. So I'm going to be sharing the link to our YouTube channel where I'm going to be posting this this recorded session so that you all have access to the recording, and as well as in that email with the link to the YouTube channel to this particular session, I will also attach the presentation and some other resources that you will be benefiting from this. So you'll get that in next week because we'll have to process this talk and then we'll put it on YouTube channel and then we'll share it with you.
Great, thank you.
No problem. Okay, so Jenny, I don't think there are any more questions. However, I'm sure if there are any questions, I have your contact information, and if you three are okay sharing your contact information, I can include that in my email as well, so that partners can directly approach you if they have any specific questions. But I would like to thank you for this information packed session and for spending your time and sharing this information with our network of partner agencies. I'm sure everybody has appreciated your time, your information, and let's continue with this collaboration and see what we can do in future to get some more interesting topics on board. So thank you so much to the presenters, Jenny, Emily, Callista. And thank you so much to the providers, our partners who spend their lunch hour with us and, making this session such a great and a successful one. You all have my information if in case you have any further questions or concerns.
Absolutely. Have a wonderful rest of your afternoon, everyone.